Yeah, so with glaucoma, it's not inherently a macular disease, although the macula is involved. Glaucoma is much more of a nerve disease. So
Mm,
the optic nerve passes from the back of the eye into the brain, and when that starts to break down, think of that as what's called neuropathy. And so neuropathy is pathology of a nerve, and in this case, it's optic neuropathy. And one of the types of optic neuropathy is glaucoma. So glaucoma is a disease that that involves a characteristic uh, pattern of breakdown of the optic nerve. And one of the things that we think of typically with glaucoma is um, tunnel vision. And the reason we think of tunnel vision is because typically, but not always, typically what happens is that there is a loss of peripheral vision. So we start off by having central vision being fine, peripheral vision out here starting to decrease, and then eventually getting to a situation where we may only have our central vision. In advanced cases of glaucoma, however, even central vision will be start to deteriorate. And so in the most advanced cases of glaucoma, in end stage glaucoma, someone will be blind uh, and black blind. I can't say that I've seen that many times in my career so far, even though I am relatively early in my career. However, it has happened into some of the patients that I have seen, but not particularly common. It's usually that we'll see some of the beginning signs of
mm,
peripheral vision starting to decrease.
right.
Having said that, just because someone has glaucoma doesn't mean they can't also have something like macular degeneration. And so then they might have some of the early signs of glaucoma or early signs of visual field loss, I should say, as well as macular degeneration. Glaucoma is a very different sort of disease when you think of that compared to macular degeneration. And the reason for it is because the symptoms typically will occur once the disease has got to quite a relatively severe state.
Mm,
And the reason for that is that because it's a nerve disease, we have a lot of very small nerves on the inside of the eyes that track around the retina, track around the macula. And if we start to have damage to some of those nerves, then there's a lot of other nerves that can kind of pick up slack, to think of it that way. However, if we get to a situation where we've had a significant nerve damage and a lot of those nerves within that small area have broken down, that's when we're going to have decreased vision. So, what I sometimes say to some of my patients is part of the reason that we want to have regular eye tests is so that way we can pick up on those early signs of glaucoma. Because if we wait to do a test if we wait until you start to notice something is wrong, we could be in a situation where you are no longer able to drive by the time that we
mm,
pick it up, because it can be that advanced before you actually start to notice something, because you have had to have such significant area of vision to have been lost for you to notice it. And by that point, there is so much damage to the optic nerve and the surrounding nerve fibers that track around into the macula, that it's very difficult to really manage that. Well, slow it down for sure, but to reverse that we cannot do currently. So um, it's a very different side of thing. It's a lot more us monitoring, us
mm,
detecting, um, and us finding that
mm,
something seems a little bit strange, investigating that, and realize, oh, this person has glaucoma. One of the tests that we always do is the eye pressure test. And previously, we used to think that high pressure necessitated glaucoma, but that's not true. About half of people with glaucoma actually have normal eye pressure,
mm,
and not everyone with high eye pressure has glaucoma. Glaucoma is a multifactorial disease. We've got pressure as one of those puzzle pieces, but there are a lot of other puzzle pieces that we need to put together. I've seen quite a few people with high pressure, and we monitor, we do all the tests. They don't have glaucoma, but we consider them a glaucoma suspect. So there's someone who we just want to keep monitoring. Someone with a family history of glaucoma, again, we want to monitor
mm,
then maybe a little bit more closely, especially if they've got some of those other puzzle pieces. But once we start to get enough of those puzzle pieces that suggest glaucoma, and we can put them together, and we can say, yes, this person, it looks like they have glaucoma because all of these different factors come into it. And glaucoma is interesting because there are a lot of different factors that we consider when we look at the health of the eye, where we look at the optic nerve, we look at the pressure, we look at the front of the eye. The cornea at the front of the eye is going to give us some really powerful information because it's made of the same material as what's inside of the nerve. We look at the angles at the front of the eye, and when we refer to the angles, that's all about the pressure as well. That is where the fluid from the eye is drained out of the eye. So if those angles are narrow, it's like having a blocked drain pipe in a way. The pressure is going to be increasing because fluid is being produced but not drained out properly. So there's a lot of different factors to consider. And even within glaucoma, there are a number of different types of glaucoma. There's glaucoma that's related to high pressure specifically without any other cause. And there's glaucoma related to high pressure because of something else. So, for example, if there is a blockage, a very specific blockage of that angle because of an issue with the iris, for example, which is the colored part of the eye, that's one type of secondary glaucoma. But if it's an issue with another part of the eye that holds the lens together, or holds the lens in place, if that's starting to wear out a little bit, then that's going to cause some blockage. If we have the angle is just getting closed because of other sources, then that's a different type of glaucoma. We can have glaucoma secondary to other things, such as issues with the macula. So someone that has uh, bleeding on the inside of their macula, as I was referring to earlier when it comes to the neovascularization, some of those growth factors can actually migrate towards the front of the eye and close that angle. And so even then, with certain macular disease, we want to be mindful of this quite severe, aggressive form of glaucoma. It's a very different type of glaucoma, and we don't see that often because usually we're pretty good at stopping it before it gets to that point. But it's certainly something that can occur. When we usually think about the more chronic forms of glaucoma, usually the ones that occur over a long period of time rather than the acute sudden changes. The symptoms then, therefore, of the acute sudden changes could be things like intense pain, very blurry eyes, very red eyes. These are typically signs of acute angle closure. So when that angle suddenly closes and the pressure increases many times, manyfold, that doesn't happen as well. I don't see that as often as I do the more chronic forms where pressure is just slowly building up, or if it's not pressure related, then the optic nerve is slowly starting to break down, whether it's because of things to do with blood flow to the eye or blood flow to the optic nerve or otherwise.
Yeah, you mentioned that glaucoma is one of those diseases that can kind of creep up on you without you suspecting it. They even call it the silent thief of sight, don't they?
Yes.
That's the nice little nickname that that particular eye disease has attached to it.
Yeah, and it is because we think of it as silent because you don't notice anything. The central vision is fine. It's one of those things with peripheral vision that we don't always notice, especially when we have two eyes open.
Yeah,